Okay, let's go. Now, chapter 4 is cell injury, aging, and death. Okay, this chapter is 44 slide. Okay, hydrophic swelling, cellular swelling because of accumulation of water. This is one of the cellular injury. Okay, is reversible. Okay. First manifestation of most form of reversible cellular injury. Result for malfunctioning of sodium-potassium pump with accumulation of sodium inside within the cell. Any injury that result is loss of energy will also result in swelling. Okay, always remember that the sodium, especially sodium, always water follow sodium. That's why if you have a lot of sodium inside the cell, water is gonna go to the sodium. Okay, because I sure that you remember for cell biology, that's through the osmosis. Okay, that is the simple diffusion of water. Okay, let's keep going with swelling of the cell. Some characteristic is large cell cytoplasm. Why? Because there is a lot of fluid inside. Dilate endoplasmic reticulum and swelling of the mitochondria. Okay? Generalized swelling of the cell in organs can lead to increase in size and weight. Megaly. Megaly always is to refer that the organ is large. Okay, if you say hepatomegaly, that means that the liver is large. Okay, if you say cardiomegaly, that means that the heart is enlarged. Okay, in medicine, always you are gonna hear hepatomegaly, splenohepatomegaly, hepatosplenomegaly, because it's always referring to enlarge of the organ. Okay? Intracellular accumulation, okay, excess accumulation of substance inside the cell, lead to cellular injury as a result, toxicity, immune response, and taking up cellular space. What happened? Everything is okay? Okay, let's keep going. Okay, intracellular accumulation, okay, characterized by accumulation of excess amount of normal intracellular substance, accumulation of abnormal substance from faulty metabolism of synthesis, and accumulation of pigment or particular that cell is unable to degrade. Okay, in this case, pigment sometimes. Okay, Maria, what's your question?
I have a question. So you mentioned that cardiomegaly is an example of enlarged organ. How does that occur exactly?
Okay, there is a lot of way that the organ get enlarged. Okay, like for example, if you have problem in the liver like cirrhosis because of alcoholism, then you have enlarged of the liver. In the case of the heart, for example, there is a lot of way that the heart get enlarged. Okay, the point right here is that megaly, what you have to know right now is that megaly means enlarge. And there is a lot of ways that you enlarge any organs. Okay. And all of them are cellular damage. Okay. It's an alteration of the cell that, if you remember from previous chapter, is an stress. You make a stress to the cell and the cell get swell, okay, get inflamed, have an inflammation. For example, in the case of the heart, if you have, let me put an example, there are, virus that make the heart bigger. Like, for example, Coxsackie virus can produce cardiomegaly, okay? For example, there is a disease that is really common in South America. I don't remember right now. It's a parasite that also produce enlarge of the heart. Okay. Also, the heart could be enlarged because of chemotherapy. When you have chemotherapy, sometimes the heart get enlarged. There are some chemo drug that produce especially adriamycin produce enlarge of the heart. Those are, sample of general medicine, but what you have to know right now is that megaly is enlarge of an organ. And most of the time is because you have an injury to the cell. Remember that everything that happens in your body start at the cellular level. Okay? Clear?
Yes, thank you.
Yes? Okay. I was talking about this accumulation of pigments. One of the pigments that sometimes get accumulate in the cell is because of the breakdown of the hemoglobin. Okay, when you break down hemoglobin, you have the heme group, and that accumulate in any organ, and that can produce damage. Intracellular accumulation, common site of accumulation, liver, spatial liver, limit protein damage, chaperone proteins, and ubiquitin protease complex. Okay, chaperone and ubiquitins, those are cells. Those are like tag. It's basically that you put a tag in one organelle or inside the cell, and those are chaperones and ubiquitin. Okay, give me 1 second, please, because I'm receiving. Okay, let's keep going. Atrophy. This is cellular adaptation. Okay. Remember from previous chapter we have stress. You produce an stress to the cell, and the response of the cell is this adaptation. Okay, atrophy is when the cell shrink, basically when the cell reduce in size. Okay, and most of the time at the end, because of all those damage, at the end the cell start losing function. Okay, that's why you have to do when you treat the patient, you try to avoid that the cell start losing function. Okay, atrophy generally caused by disease, denervation, ischemia, nutrient starvation, interruption of endocrine signal, and persistent cell injury. Those are samples of how you can produce atrophy. The most common one is when you don't use it. Is life is like that, and our body is like that. If you don't use it, you lose it. Okay, that's why you have to use your brain, because if you don't use your brain, then you develop Alzheimer. Atrophy. Biochemical pathway is ubiquitin proteasome system and lysosomes. Those biochemical pathways at the level of the cell. Okay. Hypertrophy. Okay. What is? Remember, atrophy reduce in size. Hypertrophy increase in size. Increase in the cell mass accompanied by an augment function capacity in response to physiological and pathological demands. General cause increased cellular protein content. Okay, one classic example right here is when you go to the gym. The people that like go to the gym, bodybuilder, they have hypertrophy of the muscle. Okay, and you have to be very careful because the heart is also a muscle and also get hypertrophy, and that is not good. Hyperplasia is increase in function capacity related to an increase in cell number. Okay, you have to know the difference between hypertrophy and hyperplasia. Hypertrophy take place especially in the skeletal muscle. Remember that the cells of the skeletal muscle, they are, those are cells that are always in, uh, the stage that we can replicate the muscle cell. It's like say like the neuron. Neurons and muscle cell is the same. We can reproduce the muscle cell. So in hypertrophy, that means that the same cell, the same myocyte, get large, get bigger inside. Okay, that doesn't mean that you get more myocytes. No, no, it's the same myocyte that there is accumulation of fluid or substance inside and they get bigger. In hyperplasia means that you put more cells, okay, because you increase the cell number, okay. That's one of the main difference between hypertrophy and hyperplasia, and especially in males we have benign prostatic hyperplasia. I'm gonna say this right now and try to remember always. There is no hypertrophy in the prostate gland, okay? That's a mistake in all the book that you read. Hypertrophy of the um, prostate gland, that is a mistake, okay? Because it's hyperplasia. Let's keep going. Okay, metaplasia is replacement of one differentiated cell type with another, okay? Metaplasia is when you have one cell, that cell is under one stress and they become in another cell. The classic example is when you have GERD, gastroesophageal reflux. Okay, that means that the content of the stomach start going to the esophagus. Okay, what happened? In the stomach, the epithelium in the stomach is simple columnar. That epithelium is resistant to acid. In the esophagus, we have a stratified simple, okay? Simple squamous stratified, that's in the esophagus. If the content of the stomach start going to the esophagus, then you replace that stratified epithelium for simple columnar, and that's metaplasia. And also is a precursor of cancer. Dysplasia is a disorganized appearance of cell because of abnormal variation in size, shape, and arrangement. Okay, represents an adapted effort going astray. Okay, dysplasia, in other words, is basically when you start developing cancer. Okay, because that means that you start creating new cell out of control, okay? Necrosis. Necrosis is usually occur as a consequence of ischemia or toxic injury. It's characterized by cell rupture, a spilling of content into the extracellular fluid, and inflammation. Okay? Necrosis is always pathologic, okay? And always produce a reaction, inflammatory reaction, always. We have four type of necrosis, okay? We have coagulative, liquefactive. Coagulative is the most common type. It's a process that beginning with ischemia and with the generation of plasma membrane. Liquefactive occurs with dissolution of dead cell, liquefaction of lysosomes enzyme, and formation of excess of 6 from developing dead tissue. We have fat necrosis and gaseous necrosis. Fat necrosis is death of the adipose tissue, usually the result of trauma to the pancreas, okay? And gaseous necrosis is characterized of lung damage secondary to tuberculosis. And now we have question number 1. What type of reversible cellular injury and inflammatory response? I mean, what type of irreversible cellular injury initiate an inflammatory response? Nobody know?
Necrosis.
Necrosis.
Yes.
Necrosis.
Yes, exactly. Perfect. Thank you. Listen, there is a big difference between necrosis and apoptosis, okay? Necrosis, cellular inflammation, is pathologic. Apoptosis, that's physiologic. That's programmed cell death. There is no inflammation. Irreversible cellular injury, we have gangrene. Gangrene, we have two types, dry and the other one, let me see, wet. I mean three, wet and gas gangrene. Okay? We have three types. Gangrene is cellular death in a large area of tissue result from interruption of blood supply to a particular part of your body. Okay. We have the dry gangrene form of coagulative necrosis characterized by blackened, dry, wrinkled tissue separation by the line of demarcation from healthy tissue. We have the wet gangrene is form of liquefactive, another type of liquefactive necrosis typically found in internal organ, okay, can be fatal. Gas gangrene is a result from infection of necrosis tissue by anaerobic bacteria, especially Clostridium. I don't remember because there is four types of Clostridium. Another is characterized by formation of gas bubbles in damaged muscle tissue, can be fatal also. Okay, always when you have this type, especially this with gas gangrene, for example, in any part of your body, when you touch over that tissue, that make crepitus. Crepitus is like bubbles, and that's the gas that is under the tissue. Apoptosis we have right here, occur in response to injury that does not directly kill the cell, okay? Trigger intracellular cascade, activate of cellular suicide response. Not always pathologic, not always, no, never is pathologic. It's extremely rare that you have apoptosis as a pathology, okay? Because that's a normal physiology of the cell. Remember that inside the cell we have organelles, and the organelles also get aging, get old, and they lose function. And then inside your body, what's the problem? This organelle is not working properly. You put a tag, okay, go apoptosis, and you make a new one. Type of environmental or extrinsic signal may induce apoptosis, okay? Withdrawal or survival signal that normally suppress apoptotic pathway. Cancer cell. Cancer cell always suppress apoptosis, okay? What happens in cancer cell, that the main concept of cancer is that you start producing, creating cell out of control, okay? Extracellular signals such as Fas ligand bind to the cell and trigger death cascade through activation of death receptor. Okay? Fas ligand, that's extremely important in apoptosis. Intrinsic pathway can produce apoptosis, okay? In response to severe cell damage, a protein P53. P53 is extremely important in pathology, okay? That's basically a check mark. In the cell cycle, there is points that we have P53. If you make an alteration of the P53, then you get cancer. Will increase to cellular DNA damage, trigger the cell on death. Involve number of intracellular signal and main component capsid. That's another that's an enzyme that is used for apoptosis. Irreversible cellular Yes, I think we are back. Hello, everybody can hear me now?
I can hear you.
Yeah, I
Yes,
can hear you. It logged me out for a second. I had to join back in. Yeah.
yes, that was a problem for everybody. I think it's a problem, I don't know, with the system, with the
Yeah,
Blackboard.
it's probably Blackboard, yeah.
Yeah. Okay, let's keep going. And we are right here, necrosis. A local and systemic indicator of cell death. Pain, of course, when the cell is dying, that produces pain. That's why we have ischemia. Ischemia is basically that you stop the supply to one part of your body, and that produces ischemia. Ischemia is pain, okay? Especially because when you stop the blood supply, that tissue that is not receiving the blood start producing substance that produce pain. The lactic acid. Irreversible cellular damage type of necrosis depend on tissue type. Okay, heart is coagulation, brain liquefaction, lung gaseous, and pancreas fat. Okay, those are type of necrosis. You have to know that part because it's always like that. Heart is always coagulative. Brain liquefact is always like that. Okay. Irreversible cellular damage. Gangrene refers to a large area of necrosis, wet, dry, wet, or gas. Wet and gas can be rapidly fatal, okay? And gas always produce bubbles inside your under the tissue, and that produce crepitus. Reversible cellular damage. Apoptosis is a cell death resulting from activation of intracellular signal cascade to cause cell suicide. Okay, apoptosis, in other words, is programmed cell death. Okay, hold on. Let me go back. And also, apoptosis is not related to inflammation. Okay, basically is clean. There is no messy in the apoptosis. In necrosis is a mess. Okay, you have inflammation, cellular migration, everything. Ischemia and hypoxic injury. Tissue hypoxia is most often caused by ischemia. Ischemia is a stop the blood supply caused by power failure in the cell. Okay? Ischemia is the most common cause of cell injury and injuries cell faster than hypoxemia alone. A combine of disruption of oxygen supply with accumulation of metabolite waste. The metabolite waste basically always is the one that produces the pain. Ischemia, cellular event lead to lactic acidosis. Cellular proteins and enzymes become more dysfunctional, up to the point ischemic injury is reversible, but cell death occurs when plasma, mitochondria, and lysosomal membrane are critical damage and is irreversible. There is no way to go back from here. Okay? From ischemia, this way. That's why when you have a myocardial infarction, you have a window period. The time that the patient start the onset of the symptom to the time that the patient has to be in the cath lab, we have a period, okay? It's just 6 hours. Because after those 6 hours, then you have necrosis and there is no way that you recover the tissue that is necrotic. Ischemia reperfusion injury. Ischemic reperfusion injury, we have calcium overload, formation of free radical, and subsequent inflammation, okay? And free radical, when they are free, like hanging around in your body, that produce damage. But listen, we need free radicals, okay? Because we kill bacteria when we make free radicals, okay? Question number 2. Reperfusion injury following an ischemic episode result in further tissue damage because of what? What is the answer? B, exactly. Sepsis intracellular calcium. Perfect. Let's keep going. Etiology of cellular injury. Nutritional injury. Adequate amount of fat, carbohydrate, protein, and vitamin and mineral are essential for normal cellular function. Give me 1 second. Perfect. Cellular function. Okay. Certain cell types more susceptible to injury than other. Okay. Nutritional injury. Nutritional deficiency may result from poor intake, altered absorption, impaired distribution by circulatory system, inefficiency cellular uptake. Poor intake is when you don't eat, okay? Especially people with alcoholism. Those people have nutritional deficiency. Nutritional injury, common cause of malnutrition, okay? Poverty, chronic alcoholism, acute and/or chronic illness, self-imposed diet restriction, malabsorption syndromes. That's why when you are doing diet, when you are in a diet, you have to be very careful, okay? Because we need a balance in our body, okay? We need to eat like healthy but with balance. Especially always people that they are vegan, people that are vegan, they always has to take vitamins, okay? Because their nutrition lack of vitamins, especially B12, and that produce anemia, and one anemia that is really bad because produce neurological problem, okay? Now we have the BMI, okay? Normal BMI, greater BMI greater health risk. Okay, let me see. We have a classification of the BMI. Okay, BMI, normally BMI is from 18 to 25. From 25 to 30, you are overweight. Over 30, you are obese. Over 35, you are, I think, obese too. And over 40, then you are morbidly obese. Infections and immunologic injury. Bacteria and virus can injure cells in a variety of ways depending on its virulence. Parent injury may occur indirectly by triggering body immune response. Chemical injury. Toxic chemical or poisons can cause cellular injury both directly by the becoming metabolite into reactive chemical by the body. Okay, when you say poisoning is not that you get any chemical with normal pills that in the right amounts, in the right dose, that cure the patient. If you take an overdose, that produce poisoning and that produce damage in your body. Remember always that medicine, all medication have one therapeutic dose and one lethal dose. Okay, that means that one amount of medicine is therapeutic, is to cure a disease, and one amount of the same medication, when it's huge, that can produce death of the patient. Physical and mechanical injury. We have factors: extreme temperature, abrupt change in atmospheric pressure, mechanical deformation, electricity, ionizing radiations, cellular base and aging, basic aging. Cumulative result from two factors cause cellular and molecular damage. progressive decline in proliferation and reparation capacity of cell and exposure to environmental factors. Always, always the cell get old, and when the cells start getting old, they start losing function. That's why we have the apoptosis. Okay. Cellular basis of aging. Responsible mechanism: DNA damage in our organs. In our organisms, we have DNA repair systems. Okay, that means if we have one mutation, one problem in the cell, our own DNA have their own mechanism to fix the problem. But when you have accumulation of a lot of damage, or the same damage, repetitive, a lot of time, then there is one point that the repair system is not available to fix the problem, and then you develop the disease. Reduce proliferative capacity of a stem cell, accumulation of metabolite damage theory, programs senescence theory, and free radical theory. Physiologic chain of aging: age-related decrease in functional reserve and inability to adapt to environmental demands. Now we have another question. Patient who is 85 years old, that's really old, responds to a healthcare provider every year for a flu shot. This is an important preventive intervention because
B.
exactly because there is a problem when you are getting old, your immune systems start declining. Okay, your response of your immune system start going down. That's why the flu shot is special for people that are immunocompromised. In flu shot we have two, one that is live and the other one that is inactive. The one that is inactive is the one that you give to immunocompromised patients and people over 65 years old. When I say immunocompromised patient, it's not only HIV, because everybody think that immunocompromised patient is HIV. No. People with diabetes, those are immunocompromised patients also. Somatic death of the entire organism. Not inflammation or immunologic response occur prior to death. General feature: cessation of respiration and heartbeat. Okay, let's keep going. Presence of stiffened muscle throughout body after death, that's rigor mortis. Okay, when you are dead, what happens that you don't have more ATP, and then you develop the rigor mortis, because we need ATP for contraction and also for the relaxation of the muscle. Release of lytic enzyme into the body tissue, post-mortem autolysis, and determination of brain death as proof of somatic death. Always when you have a dead person, you have to prove that is brain dead. And also sometimes you have a patient that is brain dead. When you have a brain dead, there is no way to go back. Okay, that's why sometimes it's extremely hard. It's one point in medicine that is really hard for the patient, for the doctor, for everybody in the medical field, and everybody that is involved in that situation. When you have any relative, or when you as a physician nurse, when you have a patient that is brain dead, those people are, the body basically is still alive because they are connected to machines, but the brain is dead. Okay, that means that the brain is not gonna go back. Once you are brain dead, that's it, your body is dead. Okay, the only thing is that nowadays we have machine, you put it in the ventilator and you keep that body alive, okay? And sometimes they have some reflexes, okay? And that's why the people think that the person is alive, but they are brain dead. Okay, we finished right here with chapter number 4. Now let's move to the chapter is because of lack of oxygen. What is oxygen? You mean oxygen?
Yes. So I have a question about that.
Hold
So,
on, please explain to me what happened with the oxygen, please.
oh yeah, if someone is brain dead, is it because the trauma or something like that inhibits the oxygen to get to the brain, or is it because of something else sometimes?
Okay.
Yeah, that's my question.
Ah, that's a question. Oh, sorry.
Yeah, like how, sorry, just I want to know like what exactly are the factors that could make someone, brain dead?
Listen, the factor could be million type of factor, okay? The problem is that your brain stopped working, okay? And especially you don't have any brain stem reflexes, because when you are brain dead, you have to check the brain stem reflexes, okay? If you don't
Is
have brain stem reflexes, you are brain dead.
those reflexes are the pupils changing size and right? When
Exactly.
okay. That's
And
those
pain.
are involuntary,
No,
like
those are reflexes. It's not
reflexes.
that, and those are reflexes from the uh, brainstem, okay? And also
Okay.
responds to pain. If you like rub your knuckles right here on the sternum of the patient don't do anything. Also, we have on a scale that is the Glasgow scales, and is 0. And the Glasgow scale is 0. That means that the patient is brain dead. Okay. What happens is that the heart keep pumping. Remember that the heart is not regulated by your brain. Then the heart keep pumping, and then you keep the whole body alive. And that's special. Why? Because when you are it's when you are gonna get an organs from from one of those patients, you keep the patient like that alive, and then you take off the organs. But the brain is dead. The problem is that it's extremely hard to explain, to the relative that that patient is not gonna go back to life. There is no way that you go back to life. Okay, when you heard that history that one patient was in ICU for 20 years and they get back to life, that's not brain dead. Okay.
Okay.
Another question?
I have a question.
No. Yes, go.
Can you have multiple organ failure and still like can you be brain dead as well? Like if your brain goes, I know that the heart still keeps pumping the blood throughout the body, but what about the rest of the organs?
Okay, listen. Okay, you have multiple organ failure. That means that the organ that fail, those organs is not gonna work. Okay, those organs are dead. When you refer to brain dead, you refer to the cessation of function of your brain. That's it. Okay, but of course you could have a patient that have a lot of problems and have multiple organ failures. Okay. And if the heart is not affected, the heart is still pumping. Any other question? No? Hello? Okay, if you don't have more questions, let's keep going, and then let's go to the... Now we have to cover chapter 7. And we finish right here with all the material for week number 1. Okay? Listen, for the people that haven't posted your assignment, please go ahead and try to do it today. Remember that today you are already late, okay? but try to do it today that you don't get so, you don't lose so many points, okay? Now let's gonna wait until chapter 7 and let's keep going. What do you mean which assignment? Assignment that is the one that is in the discussion board. I haven't checked, but I think there is people that haven't posted anything. If you did it, it's okay, it's perfect, okay? Thank you. Congratulations. Okay. Now let's go to chapter 7. Okay, chapter 7 is longer, it's 75 slides, okay? And right here we start with neoplasia. Okay, nice. Okay, neoplasia means that is new growth. That one means neoplasia, okay? New, new is new, plasia mean growth, okay? Implied anomaly of cellular growth tumor, okay? Malignant neoplasia is cancer. Remember that in cancer, in neoplasia, we have benign and malignant. Okay, benign growth is generally easily cured. And one of the main difference is that benign, the growth is slowly. Malignant, well, that is the growth is really fast. Okay, may not be survivable in malignant cancer, and cancer is associated with altered expression of cellular genes. Malignant tumor can kill host if untreated. Host means our body, okay? Confirmed by invasive or metastasized nature. Tissue-specific differentiate does not close resemble tissue type of origin, okay? What that means that you have a tumor in the pancreas, they start producing cell similar to the pancreas but doesn't have the same function, and also those new cell is not gonna work properly, okay? That's why they become malignant. Greater degree of anaplasia indicate aggressive malignant. Exactly. If you have more replication of the cell, then you have more malignancy. Benign versus malignant. Malignant tumor grow rapidly. That's basically one of the main difference. May initiate tumor vessel growth. Okay, that's there are some tumors that produce new blood vessels. Frequently necrotic, dysfunctional. Benign tumor does not have potential to kill host, but may be life-threatening because of its location. Does not invade adjacent tissue or spread. When they say spread, they refer to metastasis, okay? Many are encapsulated. Benign tumor more closely resembling original tissue, that's why they are benign. Growth more slowly, a little vascularity, rarely necrotic, and often retain original functions. Tumor terminology, okay? OMA means mass, okay? Suffix indicate benign tumor, okay? Adenoma. OMA mean mass, okay? Carcinoma or sarcoma indicate malignant tumor. Carcinoma refer to epithelial origin, okay? Sarcoma refer to connective mesenchymal tissue, okay? Leukemia means white blood cell, okay? Tumor terminology, sections, lymphoma, hepatomas, and melanomas. Those are all of the following are malignant. All those tissue, all those tumor are malignant. Okay, question number 1. Which characteristic best describe malignant tumor? What is the D? Exactly. Encapsulated, benignant, localized, that is in one region, benignant, vascular, that is little, benignant, the one that have greater anaplasia is the one that is malignant. The malignant phenotype allows malignant cells to ignore growth controlling signal. That's why when you have a malignancy, they basically destroy all those signals, especially the P53. P53 is one of the stop, okay? In the cell cycle, is the cell is developing in the wrong way. P53 stop the reproduction of that cell, and that cell go to apoptosis. If you damage the P53, then they start creating new cell that is not functioning well, and then you produce the neoplasia. Antisocial behavior include proliferate despite lack of growth inhibition signal from the environment, escape signal to die and achieve a kind of immortality. In that they are capable of unlimited replication, lose their differentiate feature, and contribute poorly or not at all the function of their tissue of origin. Okay, basically, in other words, for all this is that in malignancy you have growth of the cell out of control. The malignancy phenomenon, genetically unstable and able by accumulation new mutation at a much faster rate than normal cells, invade their local tissue and overrun their neighbors, perhaps worth at all. Gain the ability to migrate from their site or origin to colonize distant tissue where they do not belong, thus metastasis. Epidemiology of cancer risk factor. Cancer is second leading cause of death in the United States. Most cancer deaths occur in individuals over 55. Men have 1 in 2 risk of developing cancer. Women have 1 in 3 risk. 5-year survival rate 68%. That's general because this 5-year survival rate is every single cancer have their own 5-year survival rate. 1/3 of cancer-related deaths may be attributable to lifestyle factors. Tobacco use, that's one of the main factors to produce cancer. Nutrition, obesity, sun exposure, especially skin cancer, and sexual exposure to HPV. That's why everybody need the male and female HPV vaccine. Okay. Early screening aids in early detection. Tobacco use. Death rate from lung cancer have dramatically increased, most of the time related to tobacco. Lung cancer leading cause of death in men and women or survival rate. Okay, the most common cancer in men and women in the United States is lung cancer. The most lethal cancer in men and women in the United States, lung cancer, both. Sorry, I'm giving you the wrong information. The most lethal is lung cancer. The most common is not lung cancer. The most common in female, breast cancer; in male, prostate cancer. Tobacco use is also linked to pancreatic cancer, especially. Always, you have a patient with long history smoking and around 55, 60 years old, they develop diabetes, you start thinking about pancreatic cancer. Kidney, bladder, mouth, esophageal, and cervical cancer. Everywhere that the smoke touch can produce cancer. Okay, that's also Another is in the kidney and in the bladder. Why? Because the excretion of the substance of the tobacco is through the kidney. That's why tobacco use increase kidney and bladder. Two types of carcinogen: initiator, cause genetic damage, and promoter, promote tumor growth. Tobacco smoke contains both types. Secondhand smoking also increases risk for lung cancer. Okay? And also second-hand smoking is, you have to be very careful when you have a newborn baby, okay? Because the sudden death in newborn baby are linked to second-hand smoking. Dietary factor believed to be related to cancer risk: the fat, fiber, alcohol, antioxidants. Dietary suggestions: limit excessive calorie or alcohol intake. Okay, calorie is special. You have to limit your calorie intake because calorie intake is related to cancer and also related to aging, okay, getting old. Increase dietary fiber, fruit and vegetable. With fruit, you have to be very careful, okay, because remember that fruit contain fructose, and fructose is a sugar. And if you eat too much fruit, then you are doing nothing because you are increasing your calorie intake. Carcinogen, potential cancer causing aging. Pro-oncogene, enhanced growth production pathway. Oncogene, proto-oncogene, it is mutated or overreactive form. Tumor suppressor gene inhibits cell proliferation. Cancer may arise when the tumor suppressor gene function is lost or abnormality. Okay, listen, let me explain just a little bit this. We have the oncogene, proto-oncogene. Okay, those proto-oncogene and oncogene, those produce cancer. Most of the time, the people think that everybody have cancer. That doesn't mean that we have cancer inside. The problem is that we have genes that can produce cancer, but we have the suppressor gene. So you have the oncogene, and in top of the oncogene, you have the suppressor gene, and the suppressor gene is regulated the oncogene. Okay, in order that you develop the cancer, that means that the suppressor gene has to lose their function. You have to kill the suppressor gene, and then you have overexpression of the oncogene, and then you develop the cancer. Proto-oncogene, normal cellular genes that can be transformed into oncogenes by activating gain-of-function mutation. Gain-of-function mutation code for growth factor receptor, cytoplasmatic signaling molecule, nuclear transcription factors. Growth factor, mitogen, small cell manufactured peptides secretes into extracellular space, diffuse to near nervous cell, interact with receptor on target cell surface, activate signaling cascade, can produce autocrine signaling excessive cell stimulated growth. Growth factor receptors, transmembrane proteins, mitogens, binding area of outside of cell. Enzymes activate area on inside the cell, while bind with only one particular mitogen. Binds activate cell proliferation, and then you develop the cancer. Okay? Mutations lead to excessive responsive by expression of receptors that should not be treated at all, excessive amounts of normally present receptors, and receptors with abnormally high activity, high affinity, cytoplasmatic signaling pathway. The cytoplasmatic signaling pathway involves numerous enzymes and chemicals that normally function to transmit signal from activated receptor to cell surface to cell nucleus. Mutant proto-oncogene can activate pathway even when no signal received at cell surface. RAS gene mutation can lead to cancer. This is another type of gene that also can produce cancer. Okay. Transcription factors. Protein that must be assembled at the promoter area to begin gene transcription, normally sequestered and prevented from indiscriminate activity until appropriate signal can cause their release. Mutation may cause overproduction of transcription factor or interferes with normal function of keeping them in check. Okay, make gene mutation can lead to cancer. That's another gene that can lead. We have a lot of gene in our body that can produce cancer. But always remember that those are oncogenes. Proto-oncogenes become activated oncogenes when mutations alter their activity so that proliferation promotion signals are generated inappropriately. Proto-oncogenes. Oncogenes introduced to host cell by retrovirus. Proto-oncogenes within cell surface or mutagenic events. DNA sequence may be lost, damaged, and allow proto-oncogenes to become abnormally active. Error in chromosome replication cause extra copies of proto-oncogene in the genome. Retrovirus is an HIV, and Kaposi sarcoma is the most common cancer in people with retrovirus. And Kaposi sarcoma is produced by herpes simplex virus number 8. Epstein-Barr virus, Burkitt lymphoma. Epstein-Barr virus can produce Burkitt lymphoma, and human T lymphocyte virus type 1 can produce adult T-cell leukemia lymphoma. Okay, those are virus that can produce cancer. Hormone suppressor gene contribute to cancer only when not present. Okay, so you have to erase, you have to kill, you have to choke down the suppressor gene in order to overexpress the oncogene. Both copies of tumor suppressor genes are inactivated when cancer develops. One can inherit a defective copy of tumor suppressor genes, much higher risk for cancer development. This means that we always inherit from your parents two genes, always. If you have one that have a problem, then you are more at risk because only one is working. Tumor suppressor gene mutation can cause the gene to not function. Chromosomes deletion, point mutation, non-disjunctions, epigenetic process, silence. The gene does not require mutation. Retinoblast RB stands for retinoblastoma gene, okay? And that produces retinoblastoma. It's a tumor in your eyes. Normally, master break for the cell cycle. Normally, block stop cell division. P53 and RB both work in the cell cycle. Okay? Bind transcription factor inhibit this factor from transcribing gene that initiate cell cycle. Normally can be induced to release transcription factor when sufficiently phosphorylated. This gene is special because in order to develop retinoblastoma, you have to break down both genes. That is two-hit hypothesis. That's why that type of cancer is extremely weird. Okay, let me keep going. An inactivated mutation of the RV gene remove restraint of cell division and replicate occur. The effective R gene common in some cancers, especially retinoblastoma. P53 genes is basically the same like RV, okay? Most common tumor suppressor gene, the effect identified in cancer cell. More than half of all type of human tumor lack function of P53. Normally P53 inhibits cell cycle, accumulated only after cell damage, bind damaged DNA and stall division to allow DNA to repair itself. May direct cell to the initiating apoptosis. Okay, give me 1 second, please. 1 second, I'll be back. Okay, I'm here. The problem is that the battery is gonna die. Okay, let me put the chart. Let's keep going. Okay, then we keep going with the P53. Mutation of damage to the P53 allow genetically damaged unstable cell to survive and continue to replicate. Okay, that's why P53 is so important. Okay, chemotherapy, radiation, damage target cancer cell to trigger P53 mediated cell death. And if you have a cancer cell that have a mutation in P53, then they develop resistance to the therapy. BRCA1 and BRCA2, those are other two suppressor genes, and those are special in breast cancer. Okay, that's why sometimes there are females that when they have a family history, they get tests for BRCA1 and BRCA2, and they may what Angelina Jolie do, that they prophylactically remove the breast, but that is not real. Okay, if you have that mutation, that doesn't really means, and it's not extremely related that you are gonna develop the breast cancer. That's why the real advice is that you don't check those markers. Multi-step nature of carcinogenesis: initiation, promotion, and progression. Initiation: initiated event, genetic mutation, inappropriately activate proto-oncogene, inactivate tumor suppressor gene. Okay, that's how you start developing the cancer. Okay, proliferation required for cancer development. Each type of cancer has its own combination of mutations that lead to the malignancy. That's special, particularly for every single cancer. Always, the first is that you have to shoot down, stop, kill anything that affect the suppressor gene, and then the oncogene gets expressed. Okay, complete carcinogens, capable of initiating cell damage, capable of promoting cellular proliferation. Partial carcinogens, promoters that stimulate growth, incapable of causing genetic mutations sufficient to single-initiated cancer. A stage during which mutation cells proliferate, activation of another oncogene, inactivation of tumor suppressor genes, nutritional factors, and infections. Regulated by many hormone growth factors, hormone may be promoted for certain cancer, estrogen, testosterone. Estrogen is special for cancer in females. Cancer cells produce telomerase, allowing immortality in cell cancer. Okay, telomerase. Remember that every gene have a telomere, and telomerase is the one that enlarge the telomere. Okay. Progression, mutation, proliferation cells begin to inhibit malignant behavior. Cells whose phenotype gives them a growth advantage proliferate more readily. Involved tumor cells differ significantly from the normal tissue. That's why always when you have a tumor, the new cell that you make is always different than the cell that they are getting from. Okay, for example, you have a pancreatic cancer, you create cells that are in the pancreas, but those cells are not working properly. Progress to malignant characteristic, laminin receptor, lytic enzyme, and courage independent and bizarre karyotype. And right here we have a question. It's good that we have question because in that way we like review. Place the multi-step nature of carcinogenesis in order.
A.
C. Initiation, promotion, and progression. Perfect. Okay, metastasis. What is a metastasis? It's a process by which cancer cells escape their tissue of origin and initiate new colony of cancer in distant sites. Okay, that's why maybe you have cancer in the lungs and then you develop metastasis to the brain, to the liver, any distant part from the origin of the cell. And sometimes when you have a patient, what you discover is a metastasis. Okay, that's why when you have a patient that you discover that the patient have a cancer, you have to do a CT scan, PET scan to see if there is any other damage in the body. Okay, and you find another body, another damage, mean then you have to determine which one is the original damage. Okay. Okay, specialized enzymes and receptors enable them to escape their tissue of origin and metastasize. Specialized enzyme and receptor allow them to replicate at new sites. Patterns of spread. Okay, cancer cells generally spread via circulation of lymphatic system. That means blood vessel or the lymph. Tumor markers help identify parent tissue of cancer origin. Rarely on some retention of parent tumor characteristic. Some released into circulation, others identified through biopsy. Most of the time, to have the final diagnostic of any cancer, always you have to do a biopsy. Okay, there is just few cancers that you don't do biopsy. tumor marker help identify parent tissue of cancer origins. Enzyme protein typically used as a tumor marker help track tumor activity, increase blood levels, progression, and proliferation. Let me see if they talk about tumor marker. Okay, listen, tumor marker. The main function of the tumor marker is not to diagnose the patient. The tumor marker, in medicine, we measure tumor marker to follow the progression of the treatment, okay? If the treatment is working or not, okay? That's the use of the tumor markers. Okay, angiogenesis, process by which cancer tumors form new blood vessels in order to grow. Usually does not develop until late stage of development. Triggers are not generally understood. Inhibition of angiogenesis is an important therapeutic goal. Of course, because angiogenesis basically is the one that gives like food to the cancer, okay? Question number 3. Which term should be used when describing the process of tumor forming new blood vessels? Okay, that one is extremely easy. Exactly. Angiogenesis, okay? Grading and staging of tumor, that's an extremely important step when you have a patient. When you have a patient, first you have the diagnosis, the patient have a cancer. Next step, you have grade. You have to stage the patient, okay? Because in that way, you know if you know the prognosis, the outcome, how it's gonna be the outcome of that patient. Because if you catch the cancer in early stage, stage 1, maybe the outcome is good, but you catch the cancer in stage 4, most probably it's gonna really bad, okay? Predict clinical behavior of malignant tumor and guide therapeutic management. Grading. Histology characterized by tumor cell, degree of anaplasia, 3 or 4 class of increased degree of malignancy, graded degree of anaplasia equal to graded degree of malignant potential, okay? Always all cancer are until number 4, okay? Right here. Staging. Location and pattern of spread within the host tumor site, extent of local growth, lymph node or organ involved, distant metastasis. That's when you have distant metastasis, that's grade 4. Okay. TNM, okay, tumor node metastasis. That's what they stand for, and that's how you grade the malignancy. Let me go back. Tumor is the size of the tumor. Node is the lymph node are involved, and metastasis is you have damage to distant organ. Depend on location of tumor and extent of metastasis, effect of cancer on the body. Okay, early stage may be symptomatic, tumor increase in size and spread, symptoms become apparent. Okay, and that's extremely important because there are some cancer because of the location. Always when you catch the patient with that cancer, always is gonna be an advanced stage, especially when you have pancreatic cancer in the tail of the pancreas, because most of the time those cancers are symptomatic all the time, and when they develop the symptom, it's because the disease is really advanced. Warning sign of cancer: change in bowel bladder habits, sore that does not heal, usual bleeding or discharge, thickening or lumps in breast or anywhere else, ingestion on difficulty swallowing, obvious change in word or more, nagging cough of hornets. Those are some indicators that maybe something is wrong, okay? In children, unexplained weight loss, always when you have unexplained weight loss, you have to start thinking in malignancy. Headache with vomiting in the morning, especially in the morning, okay? If you have a headache and you have vomiting throughout the whole day, but if you have headache and vomiting in the morning, that means that most probably you have a mass in your brain, okay? And you increase the intracranial pressure and that produces the vomiting. Hold on, give me 1 second, please. Okay, a lump or mass in the abdomen, neck, develop of whitish appearance in pupae. That always means, most of the time means that you have anemia, recurring fever, not caused by infection, excessive bleeding, bruisings, and so on. Pain. Common amphipheric complication may be because of metastasis, tissue destruction, inflammation, may be caused by cancer treatment. Yes, the problem with cancer treatment is that chemotherapy have a lot of side effects, okay? And the most common one and the first one is diarrhea. Usually controlled with analgesic, okay? Most of the time when you have a cancer patient, those analgesics has to be very potent. And most of the time you have to use opioids, okay? Cachexia and immune system deficits. Cachexia is overall weight loss and generalized weakness, loss of appetite, increased metabolic rate, nausea, vomiting, and one physical finding, one physical sign that the patient is cachexia is that the patient is losing weight, is underweight, and have temporal wasting. Temporal wasting is right in your head, in the temporal bone, right there you have wasting, okay? Immune system suppressed by cancer cell secretion. Some cancer can elude immune system detection. Contribute to anemia, leukemia, and thrombocytopenia. Anemia, decrease red blood cell, leukemia, decrease white blood cell, and thrombocytopenia, decrease platelet, caused by invasion and destruction of bone marrow cell, poor nutrition, and chemotherapy. Anemia, deficiency in circulation red blood cell. Leukopenia is deficiency in circulating white blood cell, okay? That means decreased white blood cell. Primary cause, malignant invasive of bone marrow. Contributing factor, malnutrition, chemotherapy, because chemotherapy keep the blood cell and then you develop leukopenia. Opportunistic organisms can only affect immunocompromised hosts. Okay? Leukopenia, infection difficult to manage, try to prevent, may cause change in chemotherapy treatment, may be suspended until white cell can recover. Always you have to measure white blood CBC. You have to do a CBC in a patient when they are taking chemo, okay? If the white blood cell is too low, you have to stop the chemo and you have to recover the patient, because if the leukocytes are too low, those patients are susceptible to any infection. Thrombocytopenia, deficiency in circulating platelet, important mediator in blood clotting, predisposed to life-threatening hemorrhage. Account is below 20. The problem with the platelet is that in order to have risk for bleeding, the platelet has to be extremely low. You see right here, 20,000. Normal level of platelet is from 100,000 to 400,000. So 20,000 is extremely low. Anemia, leukemia, thrombocytopenia. Okay, let's keep going. Other effect: hair loss, slugging of mucosal membrane. Damage to the mucosal membrane is one of the main effects of chemotherapy and radiation. Okay, damaged mucosa, primary sources of cancer, pain, and anorexia may provide a portal for infections. Remember that in the mucosa we have, hold on. Okay, I have a problem with this. Wait a second. Okay. The mucosa we produce immunoglobulin A. Okay, if you have damage to the mucosa, then you decrease your immune response. Paraneoplastic syndrome, tumor produce of hormone or cytokines. Hypercalcemia, Cushing syndrome, secondary to ACTH secretions. Hyponatremia and water overload, secondary to excessive ADH. Hypercalcemia is secondary to secretion of parathyroid hormone-related peptide. Early detection, best prognosis for cure, always. Mainstay of therapy, surgery, radiation, drug, guides chemo, emerging therapies, immunotherapy, target molecular therapy, stem cell transplantation. Nowadays, this is under investigation because there's a lot of research nowadays about the stem cell. Okay, that's why you have a baby, it's good that you get some umbilical cord cell and the blood, because in those cells there is a lot of stem cell. Stem cell means those are precursor cells. Okay, those are cells that can become in any type of cell in your body. Surgery: majority of patients with solid tumor are treated with surgically. Main benefit: removal of the tumor with minimal damage to other body cells, commonly accompanied by radiation therapy and chemotherapy. Basically, always you remove cancer and then you give chemo, because if you have cancer, for example, in the pancreas, sometimes it's not only in the pancreas, also it's involved in some surrounding tissue. Radiation therapy kills tumor cells but damaging nuclear DNA, kills cells that are non-resectable because of the location, missed by surgery, or undetected. May not kill cells directly, but initiate apoptosis. A small dose of radiation or over several treatments difficult to kill at once because cells are one differentiated cycle. Some normal cells killed during radiation therapy. That's normal. That's why this type of therapy produce a lot of side effects. Okay? Because not only kill the cell and not only damage the DNA of the malignant cell, also damage your DNA of normal cell that you have in your body. Drug therapy: we have systemic administration of anti-cancer chemical to treat cancer known or suspected to be disseminated in the body. Find cancer cell target in the body. Most are cytotoxic, not selected for tumor cell. Normal cell death may also occur. Always that happen. Okay? Most effective on rapidly dividing cell. That's why the most common side effect of chemo and radiation therapy is diarrhea, because remember that the cell that is covering your GI, those are epithelial cells, and those are the cells with most mitotic activity. Serious side effect: bone marrow suppression. Promising approach is to inhibit angiogenesis by the tumor with anti-angiogenic drug. Immunotherapy primarily involves use of interferons, glycoprotein produced by immune cells in response to viral infection. Interferons is especially used nowadays in multiple sclerosis. Interleukins, peptide producing and secreting by white blood cells, also called lymphokines or cytokines. Monoclonal antibodies, antibodies with identical structure that bind with a specific target antigen, generally used as an adjunct to surgery, irradiation, and chemotherapy. Gene and molecular therapy may have a high therapeutic potential, may be used to suppress overactive oncogene, may replenish missing tumor suppression function. Current uses: genetic alteration of tumor cells to make them more susceptible to cytotoxic agents or immune recognition. Genetic alteration of immune cells to make them more efficiently kill the tumor cell. Can be directly at cell other than cancer cell. Okay? Enhance the host immune systems against the cancer and target the cytoplasmic signaling pathway. Stem cell transplantation used to manage life-threatening disorder in which patient bone marrow cannot manufacture white blood cell, red blood cell, or platelet. Used in malignant and non-malignant disorder, provide a method to restore bone marrow function after high-dose irradiation or chemotherapy. But as I said before, this here in the United States, this stem cell is still under investigation. That's why it's not widely used nowadays. Stem cell transplantation need donor tissue matches individual to patients allogenic and identical twin syngeneic patient-owned stem cell autologous. The best transplantation is this one. Unit 2, defense case study. Okay, now we have a case study. Let me see. Your coworker SC tells you she is afraid of having a body with a congenital malformation. She is afraid that she may be giving a drug that could harm the body and asks whether there is a way to know if drug is bad or not. She is also concerned about which infection she could be exposed to that would cause her body the most harm. Case study discussion question: discuss the 5 pregnancy category for medication administration. Listen, this you have to do it as a homework, okay? Because there is 5 category for a drug, okay? When we refer to pregnancy, the only one that you could use in pregnancy is category 1 and 2, okay? From 3 down, 3 maybe in extremely rare cases, 4 and 5 is impossible because those produce a problem in pregnancy. Discuss with infection agent. She should be most concerned about and report to her physician. Okay, those questions and the case study is for you to study. Okay, so you have to go over this video and try to answer those questions. And we finish right here with chapter 7. You already have chapter 1, 2, 4, and 7. And those are the chapters that you need for check your understanding quiz and reading quiz number 1. Okay? Any question?
Yes, I have a question. So, understanding. Hello?
Hey, yes, go.
Okay, understanding the subject is one quiz that has to be due this Sunday, and then the other quiz is due this Sunday as well.
Yes, both quizzes are gonna be the due date is on Sunday. Listen, for every week, if you go to the syllabus, you are gonna see that every week we have one discussion and two quizzes most of the time, unless week 5 that only we have the midterm, and then we have another week that have, and week number 6 you have one paper, and week number 8 you have to do a video that is another research. Okay, for all the other weeks, always Wednesday is the due date for your discussion. You put your discussion, okay, and Sunday is the due date for quiz. Reading quiz and check your understanding and reply to 2 of your classmates. All that is always in Sunday. Okay. Any other question?
No.
For the case study that you want us to do for homework, do you want us to send it to you? How are we going to report
No,
this
no, no,
case
no, no,
study?
no. No, no. This case studies is for you to study. You don't have to
Oh, okay.
report to nobody. Just
Oh,
report to
okay.
yourself. Okay.
To myself. Okay, thank you. Okay.
No, it's for you to study because the pregnant category is something really know really good that you know, because pregnancy is a little bit complicated when you have to give up medication.
Yeah, no, and it's good. It's good to know. Thank you.
Okay, perfect. Listen, somebody asked me about the quiz. The lockdown browser is for reading quiz. Okay, the check your understanding, there is no lockdown browser for that one. Okay, that's why check your understanding is, I think, it's already open. You could do it at any time. Okay, but quiz number 1, that is the reading quiz number 1, is gonna be open on Saturday. Okay, this Saturday at 8 in the morning, and it's gonna close Sunday 11:59. Any other question?
Are those